The average ambulance response time in the United States is somewhere between 7 and 14 minutes, depending on where you live, and in rural areas it can stretch well beyond 20 minutes. That means during that gap, that terrifying window where you are waiting and feeling helpless, your brain may be losing nearly 2 million neurons every single minute. 2 million. That number comes from a landmark analysis published in the journal Stroke, and it changes how you should think about those first few minutes. Right now, somewhere in the world, someone over 65 is feeling a strange weakness in their arm or noticing their words are not coming out clearly. And what most people do in that moment is freeze. They sit down, they wait, they tell themselves it might pass. But during a stroke, time is not neutral. Time is damage. Now, let me ask you something directly. What if I told you there are specific things you can do in the first 3 minutes of a suspected stroke that dramatically increase your odds of survival and reduce the chance of severe damage? Not magic tricks, not internet myths. Real, medically grounded actions that can stabilize your body while emergency help is on the way. No action can guarantee 101% survival. Anyone who says that is lying, but here is what is true. The difference between panic and preparation can determine whether you protect your airway, prevent a fall that causes brain injury, avoid choking, and reduce secondary complications before paramedics arrive. Most seniors freeze. They wait. They hope it passes. They try to lie down alone. They lose time. But trained responders know something critical. The first 3 minutes are about position, oxygen flow, awareness, and immediate communication. Those minutes can shape everything that follows. In this video, I am going to reveal 5 immediate actions every senior must know to take before help arrives, ranked from essential to absolutely critical. Stay with me, because action number 2 is the step that many people skip, and skipping it can cost precious brain tissue. But before we begin, tell me something honestly. How old are you right now, and would you recognize the first warning sign of a stroke immediately? Write your age and where you are watching from in the comments. We are reading every single one and replying personally. Now, let's begin with action number 5, because this first step must happen within seconds if you want to give yourself the strongest possible chance. Number 5, immediately call emergency services and unlock your front door. This might sound like the most obvious step in the world, and you might be thinking, why would this even need to be said? But the reality of what happens during a stroke is nothing like what people imagine when they are sitting calmly thinking about it. When a stroke hits, it does not come with a polite warning. It crashes into your brain like a wave, and suddenly you are confused, disoriented, dizzy, and terrified. Your first instinct is not to call for help. Your first instinct, according to research from the University of Michigan published in the journal Stroke, is to sit down, wait it out, and hope it passes. That study found that nearly 40% of stroke patients delayed calling emergency services by more than 3 hours because they believed their symptoms would resolve on their own or because they simply did not recognize what was happening. That delay is devastating because the primary clot-busting treatment for ischemic stroke, a drug called TPA or Alteplase, must be administered within a strict window of 3 to 4.5 hours from symptom onset, and every minute of delay reduces its effectiveness. So the absolute first thing you must do the instant you notice any sudden symptom, whether it is numbness on one side of your body, slurred speech, sudden confusion, vision problems, or a crushing headache unlike anything you have felt before, is pick up your phone and dial emergency services immediately. Do not call your daughter first. Do not call your neighbor. Do not Google your symptoms. Call the ambulance. And here's the part that most people never think about, but that emergency medical technicians say costs them precious minutes on a regular basis. After you make that call, before you do anything else, go to your front door and unlock it. If you have a deadbolt, turn it. If you have a chain, slide it off. If you have a screen door that latches, unlock that too. Open the door wide if you can. A report from the National Association of Emergency Medical Technicians found that locked doors and inaccessible entryways are among the top 5 causes of delayed treatment in home emergencies, and paramedics have described arriving at a house, knowing someone is having a stroke inside, and being unable to get in for 5 or even 10 minutes while they wait for someone to open the door or while they figure out another way in. If your symptoms are already too severe to walk to the door, call a neighbor or family member immediately after calling the ambulance and tell them to come open your door right now. Some stroke specialists now recommend that seniors who live alone install a smart lock that family members can open remotely from a phone app, or keep a lockbox with a spare key outside the front door and share the code with their local fire department. Whatever method you choose, the principle is non-negotiable. When that ambulance pulls up, there must be zero barriers between those paramedics and your body, because every second they spend trying to get through your door is a second your brain cannot afford to lose. Getting help on the way is essential, but what you do with your own body in the next 60 seconds could change everything. But before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 4, chew one regular aspirin slowly if you are not on blood thinners. Now, this step comes with an important condition that you absolutely must understand before you do it, so please listen carefully. If you are not currently taking any blood thinning medication, such as warfarin, apixaban, rivaroxaban, or any other anticoagulant, and if you are not allergic to aspirin, then chewing one regular 325 milligram aspirin tablet the moment you suspect a stroke could be one of the most important things you do in those waiting minutes. The key word here is chew, not swallow whole with water, because chewing the aspirin crushes it into smaller particles that are absorbed through the lining of your mouth and into your bloodstream far more rapidly than a pill that has to travel all the way down to your stomach and dissolve there first. A study published in the Journal of Thrombosis and Hemostasis found that chewed aspirin reaches peak blood concentration in approximately 5 minutes, compared to 12 to 15 minutes for a swallowed tablet, and during a stroke, that difference in absorption speed matters enormously. Here's why aspirin works in this situation. Approximately 87% of all strokes are ischemic, meaning they are caused by a blood clot blocking an artery that supplies the brain. Aspirin is an antiplatelet agent, which means it prevents the tiny blood cells called platelets from clumping together and making that clot bigger. It does not dissolve the existing clot, but it stops the clot from growing, which limits the amount of brain tissue that gets cut off from blood flow. The International Stroke Trial, one of the largest stroke studies ever conducted with over 19,000 patients across multiple countries, found that patients who received aspirin within the first 48 hours of an ischemic stroke had significantly lower rates of death and recurrent stroke compared to those who did not receive aspirin. Now here is where the critical condition comes in and why I've stressed it at the beginning. If you are already taking a blood thinner, adding aspirin on top of that can cause dangerous and potentially fatal internal bleeding, including bleeding inside your brain, which can turn a survivable stroke into a deadly one. If you are not sure whether your medications include a blood thinner, do not take the aspirin. If you have any history of stomach ulcers or bleeding disorders, do not take the aspirin. When in doubt, skip it and focus on the other actions on this list. But if you know with certainty that you are not on blood thinners and you have no aspirin allergy, keep a small bottle of regular uncoated aspirin in an easy-to-reach location in your home, your nightstand drawer, or your kitchen counter, and the moment you suspect a stroke, put that tablet in your mouth and chew it thoroughly before swallowing. The taste is bitter and unpleasant, but that bitterness is the aspirin breaking down and entering your bloodstream to fight for your brain. Dr. Peter Rothwell of the University of Oxford, one of the world's leading researchers on aspirin and vascular events, has published extensive work showing that early aspirin use in acute stroke settings provides a small but meaningful reduction in long-term disability. And when you are fighting for every neuron, small but meaningful is everything. Getting aspirin into your bloodstream is a powerful move, but now you need to protect your brain from another invisible enemy that makes every stroke worse. Number 3, lie down flat and practice slow, controlled breathing. Once you have called for help, unlock your door and chew your aspirin if it is safe for you to do so. The next critical action is to carefully lower yourself to the ground and lie flat on your back, and then immediately begin a specific breathing pattern that has been shown to directly protect your brain during a cardiovascular emergency. Let me explain why both of these things matter so much. First, the lying down part. When a stroke is happening, your brain is desperately trying to maintain blood flow to the areas that are being starved by the clot or damaged by the bleed. If you were sitting upright in a chair or worse, trying to stand or walk around, your already compromised cardiovascular system has to fight against gravity to push blood up to your brain. A study published in the journal Neurology found that body position during acute stroke significantly affected cerebral blood flow velocity, and patients who were supine, meaning lying flat, had measurably better blood flow to the brain compared to those who were seated upright. Dr. Larry Goldstein, a former director of the Duke Stroke Center, has explained that maintaining cerebral perfusion, which simply means keeping blood flowing to brain tissue during the early minutes of a stroke, is one of the most important factors in limiting the total area of damage. So you get yourself down to the floor gently, lie on your back, and if possible, place a small pillow or folded blanket under your knees for comfort, but keep your head flat or only very slightly elevated. Do not prop your head up on a high pillow because that can reduce blood flow to the brain. Now here is where the breathing becomes essential. The moment a stroke hits, your body launches into a full-blown panic response. Your sympathetic nervous system floods you with cortisol and adrenaline, your heart rate skyrockets, your blood pressure spikes even higher than it already is, and your blood vessels constrict. Every single one of those responses makes the stroke worse. A 2019 study published in the Journal of the American Heart Association demonstrated that acute physiological stress during cardiovascular events significantly increased the zone of brain tissue damage. The antidote to this is deliberate slow breathing, specifically a pattern where you breathe in slowly through your nose for about 5 seconds, letting your belly expand rather than your chest, and then exhale slowly through your mouth for about 6 to 7 seconds, as if you are blowing gently through a straw. This rhythm of approximately 5 to 6 breaths per minute activates your parasympathetic nervous system through the vagus nerve, which is the longest nerve in your body and acts as a direct brake on your stress response. Dr. Herbert Benson at Harvard Medical School spent decades studying this mechanism and found that deliberate slow breathing could reduce blood pressure by 10 to 15 millimeters of mercury in just minutes. During a stroke, that reduction in pressure decreases the force being exerted on already damaged or vulnerable blood vessels in the brain and can meaningfully limit how far the damage spreads. If someone is with you, ask them to breathe with you and count out loud, because research from the University of California showed that guided breathing reduced physiological stress markers by nearly 40% in emergency patients. You do not need to count perfectly. You just need to slow down, override the panic, and give your brain the calm, steady blood flow it is fighting to maintain. Your body is positioned and your breathing is protecting your brain, but there is one more piece of preparation that could change every medical decision made about your treatment. Number 2. Gather your medication list and note the exact time symptoms started. This action is something you do with your mind and your memory in those minutes on the floor, and it could single-handedly determine whether you receive the most effective stroke treatment available or whether doctors have to guess and hope for the best. There are 2 parts to this, and both are equally critical. The first part is your medication list. When paramedics arrive and when the neurology team at the hospital takes over your care, the very first questions they ask have nothing to do with how you feel. They are going to ask what medications you take, what dosages, whether you are on blood thinners, and whether you have any allergies. The reason these questions come before everything else is that the answers directly determine which treatments are safe to give you. That clot-busting drug TPA that I mentioned earlier is extraordinarily effective, but if you are already taking a blood thinner like warfarin, and the doctors do not know that, giving you TPA can cause catastrophic bleeding inside your brain. A study in the New England Journal of Medicine found that medication errors during acute stroke treatment, frequently caused by incomplete or unavailable medication histories, were associated with significantly higher rates of dangerous complications. The American College of Emergency Physicians has endorsed a program called File of Life that provides seniors with a standardized form and a bright red magnetic pouch designed to be stuck on your refrigerator door, because paramedics in many jurisdictions are actually trained to check the refrigerator for medical information. If you do not already have a written medication list prepared, and I strongly urge you to make one today after watching this video, then use these minutes on the floor to mentally review your medications so you can tell the paramedics clearly when they arrive. Even better, if your phone is within reach, open your Notes app and type them out, or call a family member who knows your medications and put them on speaker so they can relay the information directly. The second part of this action is equally important, and this is something that stroke neurologists say is the single most overlooked piece of information in stroke emergencies. You must note the exact time your symptoms started. Not approximately, not around lunchtime, not sometime this afternoon, but the precise time down to the minute. The reason is that TPA has that strict administration window of 3 to 4.5 hours from symptom onset, and the neurology team cannot give it to you if they do not know when the clock started ticking. Dr. Lee Schwam, a professor of neurology at Harvard Medical School, has stated publicly that the number one reason eligible stroke patients do not receive TPA is not that they arrive too late, but that nobody recorded when symptoms began. So the moment you feel something wrong, look at your phone, look at a clock, look at your watch, and say out loud it started at and state the time. If someone is with you, make them repeat it. Write it on your hand with a pen if you have to. That timestamp is the most valuable piece of information you will bring to the hospital. Your information is ready and your time is documented, but the number one action on this list is something so deceptively simple that most people would never think to do it, and yet researchers say it may be the most powerful thing you do before the ambulance arrives. Number 1. Perform the FAES self-check and stay completely still. This is the action that every stroke neurologist, Every emergency physician and every major medical institution in the world ranks as the most critical thing a person can do during those minutes before help arrives, and it combines two elements that work together to give you the absolute best chance of survival and recovery. The first element is performing the FAST test on yourself, and the second element is something that sounds almost too passive to matter, but that research shows has a profound impact on what happens inside your brain during a stroke. Let me start with the FAST test. FAST is an acronym that was developed by researchers at the University of Cincinnati and has since been adopted by stroke organizations worldwide. It stands for face, arms, speech, and time. Here's exactly how you do it while lying on the floor. For the face component, you try to smile and you pay attention to whether one side of your face feels numb or droops downward. If you can see a mirror or your phone's front camera, look at your reflection. Asymmetry in the face during a smile is one of the earliest and most reliable indicators of a stroke. For the arms component, you raise both arms straight up from where you are lying and hold them there for 10 seconds. If one arm drifts downward on its own, or if you cannot raise one arm at all, that confirms motor weakness on one side of your body, which is a hallmark stroke sign. For the speech component, you say a simple sentence out loud, such as "the sky is blue today" or "my name is," and then say your full name. If your words come out slurred, garbled, or if you cannot form the sentence at all, that confirms speech impairment. You now take all of this information, the facial droop, the arm weakness, the speech difficulty, and the onset time you already recorded, and you hold it in your mind ready to report it to the first paramedic who walks through your door. A study published in the journal Stroke found that when patients or bystanders accurately identified stroke symptoms using the FAST protocol and provided a confirmed onset time, hospital door-to-needle times, meaning the time from hospital arrival to TPA administration, were reduced by an average of 15 to 20 minutes compared to cases where this information was unavailable. That reduction translates directly into saved brain tissue and better long-term outcomes. Now here is the second and equally vital part of this number one action, and it is the part that most people do not understand. After performing the FAST test, you must stay completely still. Do not try to get up. Do not try to walk to the kitchen for water. Do not try to pack a bag for the hospital. Do not try to change your clothes. Lie still and remain calm. The reason for this is rooted in a critical concept that neurologists call the ischemic penumbra. During an ischemic stroke, there is a core area of brain tissue that dies almost immediately because it is completely cut off from blood supply. But surrounding that core is a much larger area of tissue called the penumbra, which is receiving just enough blood to stay alive but is extremely vulnerable. This penumbra tissue is essentially on the edge between survival and death, and what determines its fate is how much stress and demand is placed on your cardiovascular system in those early minutes. A landmark study from Johns Hopkins published in the journal Annals of Neurology found that physical exertion and movement during the acute phase of a stroke increased metabolic demand on brain, which in turn accelerated the death of penumbra tissue that could otherwise have been saved with treatment. In simple terms, when you move around, your brain needs more oxygen and more blood, but the stroke has already compromised its ability to get those things, so the areas hanging on by a thread collapse and die. By staying perfectly still, keeping your breathing slow and controlled, and keeping your body's metabolic demand as low as possible, you are essentially giving that penumbra tissue the best possible chance of surviving until TPA or another intervention can restore blood flow. Dr. Schwam has described the penumbra as the tissue we are racing to save, and staying still during those critical minutes is one of the only ways you as a patient can actively participate in that race. So you lie there, you breathe slowly, you hold your FAST results and your symptom onset time in your mind, and you wait. You wait calmly, you wait still, and you wait knowing that every second you remain motionless is a second you are protecting brain tissue that might otherwise be lost forever. If this video gave you information that could save your life or the life of someone you love, please hit that subscribe button right now and tap the bell so you never miss another video like this. Thank you so much for watching. I truly appreciate you being here, and I will see you in the next one.